everyone, Charlene Ortiz here. Today I wanted to go through some exercises that are going to help the muscles surrounding your hip joint. For those of you that have had a hip replacement in the past and you would like to strengthen the muscles surrounding your hip in order to give your hip a little bit more support and more strength. Now this video is only going to be for people that are 3 months plus post-op. So if you've just had a hip replacement and it's only been a few weeks, a few days, or what have you, if it's been less than 3 months, this video is not for you. You're more than welcome to watch it, of course, but certainly until you're cleared by your doctor or your physical therapist to do exercise in full range of motion movements, you want to wait until you're cleared, because some of the movements that we do today could actually result in injury if your wound is not completely healed yet. And certain movements can actually pop the socket out of the joint. And so that's why, again, you really want to make sure you are clear to do a full range of motion exercise and make sure whatever you're aware of any limitation that you might have before you attempt to do any of these movements. For those of you that are 3 months plus post-op and you have been cleared, then I think these exercises are going to be really great to kind of get your hip back to a nice strong place, maybe even stronger than it was before your hip replacement. So there are several different approaches when it comes to a hip replacement, and the most common one, or the oldest technique I guess, is the posterior approach, where they cut through the gluteus medius in order to get to the acetabellum, which is where your femur kind of pops in, because the hip is a ball and socket joint. And so the femur kind of pops into that little, I guess it's kind of a hole or opening. And basically what they do, they replace the ball of the femur and usually the bottom part or kind of the top part of that bone, and they replace it with the metal replacement. So it's not, I mean, it's not metal. There's different types of metal that they use, but that's typically how they'll go about with the posterior hip replacement. There's also a lateral approach where they'll cut through from the side in order to reach the joint, and there's also an anterior approach. And the anterior approach in general will have a lot less limitations post-op. And so when it comes to the different types of hip replacements, depending on what the one that you got, you're going to have specific limitations. For example, with the posterior hip replacement, going beyond 90 degrees is going to be inappropriate, which is why they always say make sure that you don't sit in seats that are too low. Crossing the leg over your body is going to be inappropriate. When it comes to the anterior hip replacement, extending your leg past parallel from your body will be inappropriate. So again, depending on the type of hip replacement you got, you're going to have certain limitations. So you just want to make sure that you're going to be able to do these movements safely, and again, that your wound is fully healed, so that you can perform these exercises safely and effectively. Okay, the first exercise I'm going to do is just a modified step-up movement. I'm not going to be doing a full step-up like I have in other videos, because with this one, I want to challenge your balance a little bit more. So with the step, you can use, if you don't have any type of elevated surface, you can certainly do this movement without a step. But the step will just make it a little more challenging and add to the intensity of it. Any elevated surface that you have will work if you have a step stool, as long as it's not too high, because you don't want to be starting at a real high range of motion when you're first getting back into exercise after a hip replacement. And you can also purchase these steps on eBay or Amazon or pretty much anywhere. Another great place to get these steps that I've found them are at garage sales, and that's actually a really awesome place to find used exercise equipment that people just don't use anymore, and they're often selling them at really cheap prices. So if you're a garage sale person, I definitely am. You can certainly find steps like this in a lot of garage sales, but I will put a link in the description below on where you can get a step similar to this one. And I found them on eBay. They're only like $17 to $18 with free shipping. And they're just a really nice addition to have to any home gym. But if you don't have something like this, again, any type of a low step stool, if you have steps at home, but you want to make sure that the step is big enough for your whole foot to be able to fit on the step, because we're going to have to be putting the pressure through the heel of the foot. So that's going to be important. So You want to keep that in mind when you're performing this movement. Okay, so first we get into our neutral, which you guys already know, shoulders back and down, abs and pull nice and tight. As I come through, I'm going to be pushing through the heel of the foot as I'm lifting my leg up into the air, the opposite leg. Also, when I'm landing, I'm just landing on my toe. I'm not letting my foot completely land on the ground, because again, that will challenge my balance and my stability even more so. And when I'm pushing through the heel of the foot, that's going to help to activate my glute muscles more, because a lot of us have a very difficult time activating our glutes. And this exercise will help you to learn how to activate your glute muscles and use those muscles to support you in all your daily activities. Okay, so again, it's just a real simple movement. Although it looks simple, it doesn't take long for you to start to feel the fatigue kicking in, particularly in your glute muscles. But also it's going to improve your proprioception, which is your body's ability to stabilize itself in an unstable situation. And developing balance and stability is going to be key in being able to maintain hip strength after a hip replacement. And for those of you that are thinking about having a hip replacement, or you're not sure if it's appropriate for you to have one right now, or you'd like to avoid it, these will also be great exercises for you to do to strengthen, again, the muscles surrounding the hip. So again, maybe you'll be able to avoid a hip replacement if you start becoming more active and putting more time and effort into strengthening those muscles. But again, only if it's your doctor's recommendation. Okay, so the next exercise I'm going to do is just going to be an extension exercise and an adduction. And so with this, I'm just using my little band right here. And again, these you can get on eBay. And I got this nice set right here for like $4. It wasn't that expensive, but you can get them, again, pretty much online anywhere. This is a movement that I have done before in other videos, but this is a really great one. Again, for specifically strengthening your glute muscles as well as your abductor muscles. So with your shoulders back, abs in nice and tight, all you're going to do is just extend the foot out to the side. It's not going to be a great range of motion, so don't worry about how far you can go. And you also want to make sure that you're keeping your neutral and you're not leaning to the side when you're performing the movement, when you're performing the abduction. Okay? And so with each movement, you'll do 10 to 15 repetitions, 2 to 3 sets, again, which is standard with pretty much anything that we do, just for those of us that want to just have basic fitness goals. Okay, so again, making sure that our body's staying in neutral and that we're not leaning to the side. The next one would be just a basic extension. Now, if you want it, obviously you can do it just on the floor, just on a flat surface. But if you really want to challenge your balance, you can also do this on the step as well. And that will just challenge your balance, making it harder for you. Okay, and again, I'm keeping my neutral spine. I'm not letting my body lean forward, because that'll be the most common tendency. And in the beginning, when you're first learning how to do the movement, if you want to, you're welcome to hold on to the wall or hold on to something in order to help maintain your stability. Okay, so again, this is going to be a straight back movement. And if you've done any of these types of movements before, like I've demonstrated in past videos, you should already know that you'll actually feel the stabilizer muscle working harder than the one that's actually doing the movement. Although you will feel this one engage, oftentimes people will feel the stabilizer muscles working even harder. All right, so again, movements are nice and controlled, and my body's staying in a nice neutral position. I'm not going back too far. I'm arching my back. I'm still keeping my neutral spine, especially in my lower back. All right, so again, I just did it elevated on the step. It just makes it a little more challenging. And another movement you can do is kind of similar to the one that I just did with the abduction. But with this one, you would do an abduction and then you would squat and then bring it back together. And remember, when we're doing our squat, we're always making sure that we're leading with our glute and our upper body is leaning forward and our knees are not coming forward at all. And I went into more detail about this movement in my video, how to properly squat and lunge and do the most common lower body exercises. So I did discuss these movements. Okay, and again, like with pretty much any lower body exercise, you're always pushing through the heel of the foot. And these exercises, they're not just for people that have had hip replacements. Anybody can do these movements, and you will certainly benefit in strengthening your glute muscles with all of these movements. Okay, so again, with these, you'll do 10 to 15 on each side, and then after that, you'll switch to the other side. All right, so that would be 2 to 3 sets of 10 to 15 on either side. So that will be an awesome exercise that you can do to strengthen those muscles surrounding the hip. Another great exercise, this one's pretty simple. It might even be one that you did in physical therapy, but if not, you know, it's still a great one that you can do, okay? And so with this movement, typically you would do this with the ball up against a wall. So pretending there's a wall right here, all you would do is push up against the ball and count for like 10 repetitions. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000, 7, 1,000, 8, 1,000, 9, 1,000, 10, 1,000, and then you would release. And again, that's just going to help to strengthen the muscles surrounding the hip. And again, you're just going to squeeze the ball up against a wall, and you're just going to hold that there for about a 10-second count. And you can, even if you haven't had a hip replacement, if you've only had it on one leg, which is most people will only have had it on one leg, you can still obviously incorporate both legs. So that way you can still maintain a balance of strength, and you don't develop any type of strength imbalance. So, and another, again, super easy exercise is just to hold the ball between your knees and just squeeze it. And again, count for a 10-second repetition. And you can even go up to 30 seconds as you get stronger. Okay, so again, these are really great. And you can also do it on a chair if you're not quite ready to get on the ball yet, that's fine. But doing it on the ball will obviously challenge your balance and your stability a little bit more. So again, those are real super simple, easy exercises that you can do, again, to strengthen those muscles that are surrounding your hip joint. All right, so now I'm going to go onto the floor, and I'm just going to end with a couple more exercises that you can do laying down. Okay, now I'm going to end with just a couple exercises that you can do from the floor. And so these exercises are similar to ones I've done in the past, but I'm going to add a little bit more movement to them. Again, just to kind of build more flexibility and range of motion in your hip. And so the first movement is going to be similar to a bridge, which I'm sure a lot of you are familiar with the bridge movement. But what you're going to do in a bridge position, you're going to extend one leg, and I just want you to lift it up and down, just like that. And don't worry so much about your range of motion in the beginning, and don't worry so much about how high you can lift yourself up. As you can see, I have my hands on my hip. The reason I have my hands on my hips is so I can feel the hip that's elevated and make sure that it's not dipping down to the side, because you want to make sure that your hips are staying nice and level. This is certainly going to strengthen the glute on the supporting leg. And you're also going to be feeling the muscles in the lower part of your back engage as well, which is a good thing because it will help to strengthen those muscles. And particularly your erector spinae, which is a muscle that goes all the way up and down your spine. And so again, this is going to be a great exercise to help strengthen the muscles surrounding the hip and build a little bit of flexibility and range of motion. I'm going to switch to the other side. So again, keeping the hips nice and level, not letting them fall down to the side. And you want to make sure you're keeping that belly button pulled in nice and tight. So even when we're laying down, we're still making sure that we're keeping that transverse abdominis activated. And again, don't worry about range of motion. Just go as far as what feels comfortable for you. Keeping your hands on your hips, making sure that the unsupported hip is not dipping to the side. And if you're feeling that it is starting to dip to the side, and no matter how hard you try, you can't control it, then you might just want to reduce your amount of repetitions. So maybe with this particular one, because when you go to perform it, I think you'll find that it's actually a lot more challenging than what it looks. And so if you want to start with just 5 repetitions to begin with, that's fine. And then as you get stronger, you can go on to 10 and then on to 15 repetitions. Okay, the last movement I'm going to do is similar to the one that we just did. But instead I'm going to do a bicycle movement. And again, this is going to help to build good range of motion and flexibility in your hip. And as I said earlier, you want to make sure that you're clear to do these types of movements and that it's okay for you to do these types of exercises. Again, this is another great one to help strengthen your lower back, because the musculature in your lower back is going to have to engage in order to stabilize you while you're doing the movement. And if you want, again, you can just start with 5 repetitions and then go on to 10 repetitions. And we're keeping our belly button in and our hips are nice and level. Now, if you put your arms down to the side, you will notice it'll be easier for you to stabilize, and that's fine. You can do that. But you just want to make sure you're staying very conscious and aware of where your hips are. Okay? And then relax. All right, I'm going to go ahead and just do a quick stretch. And this stretch, for example, if you're very fresh after posterior hip replacement, this would be inappropriate. You would not want to be doing the stretch if you're not cleared for that type of range of motion. But that's just a good stretch to do when you are cleared for full range of motion. That's a good stretch to do after this movement in order to, again, just stretch those glutes and those hips back out. So, okay, in order to get up, I'm going to rotate myself to the side. And your doctor will probably also show you specifically how you should be getting up and out of bed after your hip replacement surgery. Now, if for some reason you haven't been given specific instruction or sent to physical therapy after your hip replacement, I can't imagine why you wouldn't be. Then I would be more than happy to do a video for people that are fresh post-op. So if you're watching this right now and you haven't been given that instruction, make sure you comment below and I will do a video specifically for people that are right after surgery. But again, your doctor, your physical therapist should have already worked with you, showed you the exercises that are appropriate for the type of hip replacement that you got. And so that's why I didn't want to do a video like that, because it would be redundant if you're somebody who's fresh from hip replacement surgery and you already have exercises that you should be performing. If, again, for some crazy reason, which I can't imagine that this would happen, but if for some crazy reason you didn't get the type of instruction that you need on what you need to do after hip replacement and what limitations, you really need to make sure that you ask your doctor what you should be doing to strengthen your hip and to build flexibility in your hip right after the hip replacement surgery, and make sure that he gives you some type of a sheet of exercises or something. You just want to make sure that you have very, very specific instructions from your doctor or your physical therapist on how to sit down, how to put on your pants, your socks, how to get in and out of bed, and they should give you specific instruction on how to do those activities properly in order to reduce the risk of you popping that hip out of socket when it's in the process of healing. But again, I can't imagine that anybody would be fresh post-op from surgery and your doctor has not given you instructions on what you should and should not be doing. So, all right, guys, well, I hope that you enjoyed the video. And remember, this is not just for people that have had hip replacement. It can certainly be for anybody that just wants to strengthen those muscles, their glutes, their low back, their balance, what have you. So my next video later this week is going to be on how to help you overcome some of the most common obstacles when it comes to losing weight and why you might not be seeing the results that you want. And this video will be a response to Operation Weigh Less, because she did a video on some of the frustration she's dealing with, being someone that has chronic illness and limitations, and also seeing the results that you want to see in your workout, because obviously when you have any type of chronic illness, you're going to have limitations, and so you can feel maybe a little stuck, or you don't really know how to go further or push yourself harder so that you can see the results that you want. So I'm going to be doing a video talking about that topic and giving you guys some tips and advice on how you can overcome that. All right, guys, as always, thank you so much for tuning in. I always appreciate your time and attention. Remember, take care of yourself, protect yourself physically and emotionally, and don't forget, your health is your most valuable asset. Invest in it. Bye-bye.